Hello there, and welcome. My name is Dr. Calliope, and I'm going to be performing your examination today. How you doing today? I see. I hope by the time you leave this examination, you feel even just the littlest bit better. I'd love to get started by looking at your scalp. I'd like to check for skin abnormalities, like lesions, any patches of oil or dryness. Do you mind if I start looking around here? Excellent, thank you. So, let's look at the hairline to start. And I'm going to rifle through the hair a bit. I'm going to just go back and forth and follow this along to the ear. Quite breezy today, isn't it? Yeah. There we go. Is it nice out at least? Yeah, winter. We're gonna follow this all the way back to the ear, behind the ear. Okay. Just switch this side. Okay. And back around here. Behind the ear. Good. So let's just kind of take a peek around. See if there's anything out of the ordinary. Okay. Not really seeing anything in particular, which is good. Let me just look a little bit more behind you here. Over here. Okay, that looks good. So, do you mind if I take a little peek at your skin here? Yeah, just while we're here, we'll look for areas of flaking, excess oil, hyperpigmentation, scarring, anything like that, okay? Alright, so let's just gonna peek around here. I'm gonna feel the texture of the skin. Just using a very light touch here. Good. And do let me know if any of this is painful or tender at all. That's important to know. Okay. Looking at the chin here. And right in here. For the most part, the texture is certainly normal. There's a few little spots here and there. But nothing out of the ordinary. Good. Let's see. Just having a good look here. Texture-wise, And as I have been messing with your face, it has gotten a bit red, so it might be a bit hyperreactive. I can see the little stroke marks there. So a bit of erythema. Let me just note that down. So hyperreactive to palpation with mild erythema. There. That's something just to keep in mind. Do you typically have sensitive skin? Okay. Well, that's something we'll want to keep an eye on then. Make sure that's nothing. That is nothing deeper, right? Okay, so your eyes here. I have quite a few tests for your eyes, and the very first one is just having you look right here at my nose so that I can get a good look at your eyes. That we can look at the sclerae, we can look at the lacrimal glands, the irises, pupils, and I'm gonna have you just do a few blinks for me so I can look at the way that your eyes move in synchronicity. So just look right here. I'm going to have you just blink, blink, blink. Good. Blink, blink, blink. Wonderful. Blink, blink, blink. Excellent. Let me just keep looking here. Alright, what I want to do here is I'm going to look at each eyelid individually and look at the conjunctival tissue. I'm going to start with this upper eyelid here. I'm going to pull up. I'm going to have you look down. Okay? So, pull up, you look down. Just keep looking down. Good. Now I'm going to pull down on the eyelid. You look up. Pull down, you look up. Good. The other side here. Pull up, you look down. Down, down, down. Good. And I'm going to pull down, you look up. Up, 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 up. Good. Okay, so I'm going to have you just look up for me. Good, and can you look down? Can you look to the side? And the other side here. Good. Let's grab a little light here. So, if I could have you just look right here at my nose. Good, and I am going to bring in a bright light. There we are. And I'm just going to monitor how your pupils react to the light stimulus. Good. 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 Just keep looking right here. Very good. I'm gonna have you just keep looking at my nose here. And we're gonna bring the light in here. And then here. Good. This is called the swinging light test. Good. And then we're going to put the light down so that we can test your ability to track my fingers and move your eyes. So I'm going to have you focus right at this little intersection of my fingers. I'm just going to have you follow this as it moves around. Okay? So if I go up, and if I come down, just like that, up and down. Good. To the side. Up, down, and to the side. Up, down. Good. Just like that. This side. Up, down. This side. Up, down. Back to neutral, and then we're going to go diagonally down. Diagonally down. Diagonally up. Diagonally up. We're going to go diagonally up. Diagonally down. Diagonally down. Diagonally up. Okay, focus on these two fingers right here. I'm going to bring them in and out, in and out, in and out. Switch right here. Bring these in and out, in and out. Last one, in and out. Excellent. Okay. So I am going to give you a couple of peripheral vision tests. So I'm going to have you cover one eye here, and I'll cover the same side. I'm going to bring my fingers in. I want you to tell me when you see them in your field of vision, like right now, okay? Alright, so keep this eye covered. I'll do the same. Tell me when you see my fingers. Good. 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 There you are. And a few good jobs. Cover the other side. I'll do the same. Yes. Excellent. Good. You got those a little before I did. Yep. Perfect. Now, you can uncover your eyes, and we're going to do a little finger wiggle test. Very similar, but you're just going to tell me which fingers you see wiggling. All right? Okay. keep your eyes trained right here and tell me which fingers are wiggling. Good. Good. Yes. Mm-hmm. Good. Good. Yes. Mm-hmm. Yep. Good. Mm-hmm. Yes. Mm-hmm. Good. Good. Okay. So, for the eyes. Alright, features. All within normal limits. And we had good responses to movements of our cranial nerves. 3, 4, 6 are intact. Peripheral vision intact. All those good bits and bobs. So, let's take a little peek at your ears. So, I am going to be just palpating around on the ears, feeling around, and you just let me know if there is any pain or tenderness here. Okay? Alright, I'm gonna just feel around a bit. The helix, the lobe, and push in on the tragus. Feel behind the ears. Take a little peek here. We got a little bit of a look with the hairline during the scalp exam, but now we're especially paying focus. Is any of this painful at all? Okay, good. Let's grab our otoscope here. Just twist our speculum into place. And we are going to look inside the ears. So I'm going to pull up and back, and then I'm going to just position my hand there so that I won't be accidentally poking you. And we are going to look at the ear canal, the tympanic membrane, and here's a little informal hearing test. Can you hear the train coming? Yes, good. And just taking a peek, looking around, looking at the health of the tympanic membrane. Good. The other side here. Let's position that right there. Okay. Good. Now is another little informal hearing test. Can you hear the roar of the wind? Yeah, it's gotten quite intense at some points. So, ear canal. Both seem to be clear. And tympanic membrane is the same color each side. We've got a pearly gray color. And we have the cone of light bouncing back. We can see the tip of then that all checks out. Now for a more formal hearing test, I'm going to have you tell me whether you hear the finger rubbing sound. So there's kind of a lot of sounds going on right now. Birds, trains, wind. So see if you can pick out this soft sound, okay? Bonus points if you can tell me whether it's on the left side or the right side. So just say yes or left or right when you hear the rubbing sound. Good. Good. Yes. Yes. Mm-hmm. Both sides, good. Mm-hmm. Yes, both. Mm-hmm. Yes. Very good. Okay. So, and that would be our vestibulocochlear nerve. Good. Now for the glossopharyngeal and vagus, we will be looking at your uvula and for the first cranial nerve, the olfactory nerve. Have you noticed any issues with your sense of smell at all? Okay, nothing has a weird scent or no scent at all? Good. And what about taste? Nothing different. Good. We don't need to formally test that one unless we suspect an issue. There we are. A little finicky. I'm going to have you just tilt your head back so I can look in the nose. There we are. Okay, so I'm using this little light to illuminate the nasal passages. And this is the time of year where everything gets all dried out. Do you experience many nosebleeds? Yeah. Do you use a saline spray at all? That's been kind of a lifesaver. We're not allowed to have humidifiers in my house. Something about it messes with the furnace, so we aren't even able to do the foil pan trick, putting it on the registers because we have cats. So, saline spray's been a godsend. Okay. Go ahead and bring your head back. And for the mouth, we're going to use the more powerful light. And I'm just going to have you open your mouth. I'd like to take a little peek around first. Really illuminate in there. We'll look at the oral mucosa. Can you lift your tongue to the roof of your mouth? Good. Put it back down. Just gonna look at the teeth here. Good. You look great. So, if I could have you stick out your tongue as far as it'll go. Good, and I'm just going to keep that pressed down. Now for cranial nerves 9 and 10, I'm going to have you just say, ah. Okay, good uvula movement there. And I'm just looking at the throat wall. Smooth, non-irritated. Okay. Good. Do you have any issues with swallowing at all? Okay, no dysphagia. And do you have your tonsils out by any chance? Okay. I'm gonna feel around your thyroid here. And if I could just have you take a dry swallow for me. Just like that. There we go. Good. Palpation of thyroid. Normal. There we are. So, let's move on to the stethoscope. We are going to start with listening to the heart and lungs. So let's start with the lungs. I'm going to have you take a deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Deep breath in and out. Excellent. Deep breath in and out. Deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Last row here. Deep breath in and out. Deep breath in and out. Listen to the heart. So this is the aortic valve. We're listening to the valve opening and closing. Good. And the pulmonary valve here. The mitral valve. The tricuspid rather. Mitral's next. Tricuspid valve. And then mitral. Okay. Could I have you just flip around so we can auscultate the posterior chest wall? Good, okay. Let's start right here. Deep breath in Deep breath in and out. Deep breath in. Deep breath in. Last row. Deep breath in and out. Deep breath in and out. Good. I could have you flip back. I'm going to listen to the abdomen before putting the stethoscope away. So I'm just going to have you breathe normally here. I'm going to just take a little listen around in each of our quadrants. Need this anymore. Just going to put that down. There we are. Heart sounds normal. Yeah. Lung sounds normal. Across all lobes. You have 5. 3 on one side, 2 on the other. And then we have the abdominal sounds. So let's bring out some other methods of manual diagnosis. I am going to be percussing along the chest and the abdomen. Just gonna have you hold still. Start at the lung apices. Move our way down. Good. There. Now the abdomen here. There we go. Good. Now for palpation here. I'm going to take the flats of my fingers and feel for thrills in the heart, and I'm going to use the heel of my hand to feel for heaves. So I'm going to place my hand right here. We'll do heaves first. And just feel across each valve. Good. Okay, and the thrills here, using the flats of the fingers. And for palpating the abdomen, I'm going to use one hand here, and I'm just going to have you let me know if there's any pain or any tenderness at all. We're going to feel the size of some of the organs here. Feel for any rigidity or guarding. Looking for pain or tenderness. Okay, I'm going to do that again, but this time with two hands, so let me know. Again, this is painful. It's not going to be comfortable, but if it's painful at all. Anything with that? No? Okay. And normal resonance of the chest wall. And non-tender and non-rigid abdomen. And the organ size was just fine, no heaves or throws in the heart at all. So now we're going to take a little look at your hands. So the hands can tell us a lot about our health, even more specifically the nails. The first thing I'm going to have you do is put your nails together like so. And there should be this tiny little window between the angle of the skin to where it meets the nail. It forms this tiny little window. Okay, good. If that were not present, we would call that clubbing. And that is a sign of a cardiac issue. With the nails, we're looking for them to be clear, that we don't have any little white marks, that they are the correct tone for your skin tone, that the nails themselves look healthy, there aren't any cholesterol deposits, tar staining around the fingertips. So let's take a peek here, and then we're going to look at the circulation. For example, here, if we press down on the nail, you can see that the tip of my finger blanches, and when we release the finger, then we see that color return. Now my circulation is a little sluggish, so yours should be a little faster than this, but we can check circulation that way. I'll do that for each finger. Good. And really, within normal limits is less than 2 seconds for the blood to return. Good. Now if I could see your nails. Okay. Dry like mine, yeah. It's just a product of washing your hands all the time. For me at least. And I'm just gonna feel the joints here. Let me know if they're painful or tender. Don't see any swelling, so that's good. Each joint is non-tender. Yep, non-tender there. Could I see your palms? We can look for a little abnormal contraction here. That would make it so you can't straighten your hand out. We can look for palmar thickening. We can look at the thenar muscle, the hypothenar muscle. We can look at the color of the hands. Mine can get quite red and then blanch quite easily. But yours might be less reactive. Good. Okay. And let's go ahead and just look at the backs of the elbows. We might see plaques in this area, plaque psoriasis. Okay, good. And I'm going to feel the temperature of your skin and your joints. Is there any clamminess or extra warmth? We'll start at the upper arm and move down. Dry and warm. That's good. And then we are going to move on to the lower extremities and basically do the same thing. So let's check temperature real quick. Oh, the knees are a little cold. And then we get a little warmer. I think that's just, it's a little cold in the office today. We like to keep our heat a little lower. And then skin-wise, like the back of the elbow, somewhere we can see skin abnormalities generally are on the shins. But the skin is smooth. And if I feel around the knee here, any tenderness? No. Okay, good. Let's feel the ankles for swelling, for edema here. No, not too bad. Yeah, no, nothing really there, so that's good. And if I could just look at your feet here, bottoms of your feet. Okay, and the toes. Excellent. Okay, so last thing we need to do. I have a Taylor or Tomahawk reflex hammer here. We're going to do some tapping along some different areas of your body. So if I could have your foot, we're going to test the Babinski reflex. I'm going to use the blade of my reflex hammer to firmly stroke along the sole here. If I could see one foot. Good, the toes should curl downward on reflex. The other foot. Good. And then the ankle jerk reflex here, I'm going to tap on the Achilles tendon. So if I could just hold your foot here, and then I'll tap on the back of it. Just like that. And the other foot here, I'll hold the foot. Okay, I didn't like that first one. Let's do that again. There we go. For the knee jerk, have you put your feet down and let the legs hang freely. And then we'll tap on the knee. Okay. There we go. This one's the most forgiving of all the reflex areas. Good. And if I could see your arm here, I'm just going to put it right here and just let that stay loose. I'm going to tap on the back of the elbow. Good. And then hold the elbow and tap on my thumb, resting in the crook of your elbow. There we go. That's the triceps and biceps reflexes. So put your arm right here. Let it relax. Okay, and good. I'm just going to hold the elbow and we'll get our biceps reflex. There we are. Put that down. So, biceps, triceps, Achilles, patellar, Babinski, reflexes intact. We didn't find anything abnormal on the upper or lower extremity exam. So that will conclude your examination. Do you have any questions for me at all? Yeah, so really the only thing, we just want to keep an eye on that hyperreactivity with the skin on your face, but the eyes, ears, nose, mouth, throat, heart, lungs, abdomen, and extremities and reflexes all looked great. So I'm going to sign off here. Bid you adieu. I'd like to thank you so much for coming into my office. I really enjoyed working with you today. I hope you have a whale of a day and a good rest of your night. Thank you.